The Chief Nurse podcast, and I'm really excited today to be joined by the lovely Anna Jones. Anna, do you just want to tell everyone a little bit about yourself and the roles that you do?
Oh, thank you, Lisa. It's a delight to be here. And yes, of course. My name is Anna Jones, and I am the chair of the Association of Advanced Practice Educators UK, and we are a very happy bunch. And I'm also a member of the Wales Advanced Practice Educator Network, WAPN. I've worked in the higher education sector for over 20 years, and have had a focus on advanced practice for a large number of those years. I previously worked within the NHS as a registered nurse in critical care and coronary care, and I was awarded my PhD in 2019. I was also seconded to the NMC Advanced Practice Review, and have worked as part of that team as the Wales representative. And I'm now involved in several projects involving advanced practice right across the UK and globally, collaborating with colleagues right across the globe. And I'm currently in the School of Healthcare Sciences at Cardiff University, the programme manager for the MSc in Advanced Healthcare Practice, and have been for the past year or so.
So just a few jobs then,
roles,
Anna, that you do.
Trouble.
Just a few. So I suppose, firstly, you know how proud we are at Hallam to be a partner of AAPE, and how great we think that work is that you do. What's the benefit to the AAPE community from the existence of AAPE, and what does it offer?
I think in terms of the work that we do collaboratively with Hallam Medical, we wouldn't currently exist without Hallam Medical as AAPE UK, as you have enabled us to offer educational services and conferences, etc., to the wider membership that we have right across the UK. And I think we number over 90 institutions at the moment. You have enabled us to reach out to our members and offer that educational input for free, which has been an absolutely phenomenal and fantastic resource. So we are completely grateful to Hallam Medical for that support and for the amazing relationship that we have in terms of it's a two-way relationship, I think, in that we support you and you support us, and the way that you're enabling us to market through your web pages to get the message out there that we are holding educational events. And likewise, then we hope that we can support you in terms of enabling you to access our events and the staff, because ultimately we're here for the patient, and the relationship that we have forged and continue to forge is that which supports the patient and their patient's care to make that safer. I think that ultimately is what we are all about.
Yeah, absolutely. And speaking personally as an advanced practitioner, when you're working in those busy NHS environments, it is really hard to get that educational break. We all know the challenges around funding and time and everything. So I think the events that you guys run are fantastic, and thinking about it from a clinician point of view, they are so beneficial to all of us individuals out there that are trying to keep up to date, trying to be aware of developments, and ultimately, like you said, putting the patients at the centre of everything as well that we do.
We recognise that at AAPE it's becoming more and more difficult, and it's also becoming more and more financially difficult for people to access events. And although we charge a nominal fee, I think it was £10 for the or £15 for the conference, and we're charging £10 for CPD events, which we held one yesterday evening where we had 58 participants. And so, we are beginning to reach the individuals who need some CPD learning, some, just keeping up to date to ensure that their practice is safe and that they are working within their scope. We are beginning now to reach those individuals in times that suit them. So yesterday evening CPD, for example, was between 6 and 8 of an evening. It means that you can come home from work, you can put dinner on the table, and you can still do a little bit of learning without the pressure of going outside of the home because it's online. So I think it's important that we continue in that vein and continue to offer this education to ensure that people are up to speed, that they do feel comfortable with their practice, that they do feel comfortable with the information and the education that they're offering their patients, and training their staff and educating their own staff. And that is part of the relationship that we have between us in AAPE and Hallam Medical.
It is valuable, isn't it? We do know that times are challenging, and if you are taking away that having to travel to an event or pay to get to an event, take time off work, that all adds up, doesn't it, on the challenges that they're facing?
It does, and it's the simple stuff. It's logistics, isn't it? Where do you park?
Yeah.
How much is parking going to cost? And if we can take that pressure away from individuals, then that's a good thing. But we do value, I think, the face-to-face approach, and we may offer the conference, for example, as a face-to-face event in future, because whereas it's worked extremely well during COVID and over COVID, we're at a different stage now again, and I think people have missed that face-to-face contact and would like to renew friendships and networks. There's a lot of corridor conversations that are had that result in some fantastic work, and maybe that would be a way that the conference could help with that.
And I think that's important for us to try and get back, hasn't it? As you know, I'm a Queen's nurse, and this year will be the first year that they're going to go back to a face-to-face conference.
Yeah, I can understand why. We had an AAPE meeting this morning actually and discussed it at length, and there's a feeling in the room that actually face-to-face or maybe a hybrid approach would be the way to go, because we do respect and value that and understand that people may not be able to leave work or maybe have half a day, and traveling to conference would take that away, and maybe cost is an issue. So by possibly offering a hybrid approach, then we meet all of the needs of our members, which is what we're really ultimately working to do.
Yeah, and for people that can only get limited time and maybe nip in and out of a few of the sessions, a hybrid approach is really good for that as well, isn't it?
Yeah, and for future learning, because it'll be there as a resource for people to dip back into, which I think sometimes if you listen, if you're listening to something and you're focusing, but you want to re-listen to something to go back through it, I think that's an important resource as well.
And you often hear different things when you go back, don't you, that you probably didn't pick up on the first time.
Yeah,
so that's fantastic to hear that kind of approach. So can we talk a bit about higher education now? Because it's something that does absolutely fascinate me, having gone down that pathway of higher education. So when you're thinking about setting up an advanced practice course, what kind of things do you think about when developing the curriculum?
It's a very good question, Lisa, and the answer is vast. But we do have to take into account all of, or any PSRB, sort of professional and statutory body requirements, which may include, for example, the up and coming NMC regulation of advanced practice. So we would need to look at whatever standards of education that might be involved in that, any proficiencies in practice that we would need to incorporate. But we also benchmark and map against other requirements and other professional bodies' work and standards and capabilities. So, for example, here in Wales, we would look to Centre for Advancing Practice against all of their capabilities. We would look to potentially within MSc and advanced practice programmes to map against maybe the ARChem or FICM, the Faculty of Intensive Care Medicine standard, their requirements. We would also need to look at what the local requirements are. So our stakeholder needs, what do they need in terms of, clinical assessment? What do they need in terms of independent prescribing? We would then need to map that independent prescribing against independent prescribing standards. There are a ream and a vast range of bodies and professional stakeholders that we would need to relate to ensure that the curriculum was built and standardised against everything else across the UK to ensure that we met the stakeholders' needs and patient safety at the end of it.
So an awful lot of collaboration there then when developing that. And I presume you use previous students' experiences and feedback in that there as well?
Yeah, collaboration and co-production is absolutely key because we cannot develop programs without knowing what we need to fix because there's always something to fix. We never get it right first time. And it's a continuous process. It's not, an end point, if you like, once you've got a program, it's iterative. So you may run a module and you just think that was a good module. However, I need to develop this to ensure that the students get that out of it, using the feedback that they send back to us. So having alumni on board and having student feedback is absolutely crucial, but also having patient and public involvement feedback.
Yeah.
How does it feel to be treated by an advanced practitioner? How does it feel to be cared for by somebody who is a trainee advanced practitioner, for example? We need to know what they think to enable us to produce a better program of a higher standard that meets everybody's needs. So that co-production and collaboration is absolutely key to getting things right on the program.
And they're constantly changing, aren't they,
Oh,
in the world
yeah,
of advanced practice?
yeah,
Constantly.
yeah,
I started my journey in about 2004, and did it in the days where you still had your doing your advanced practice as well.
yeah,
And it's amazing to see how far it's come now, and
yeah,
the quality
yeah.
of what's being delivered out there is fantastic.
Yeah, and I think that's
Um,
testament to the clinicians who come back and teach for us. Like yourself, you're involved in all kinds of educational elements, and it's testament also to the stakeholders who are involved with us. They give up their time to enable us to develop the programs. It is a collaborative approach right across the board to ensure that we are delivering what's required in a vastly different NHS and a vastly different health service, with the constraints that they're under currently, and the
yeah,
needs we're constantly facing. The NHS just changes daily, and therefore we need to be on top of that.
yeah, yeah. And I presume that the fee, when I did mine, and it was predominantly nurses
Hmm.
because we were the ones that could prescribe. And I
Hmm.
presume the programs have evolved a lot now because you're not just dealing with one professional group, you're dealing with many professional groups.
Yeah, and that's been a joy to watch, and it is the joy of actually being in class at the minute because you get so many different professional perspectives, and the joy of it's truly interprofessional education. I teach currently on the work-based project here at Cardiff, a dissertation module, and half of the class are AHPs and half of the class are nurses. And you get that wonderful mix of perspectives of how to view a patient's care differently from different lens. We deal with dietitians, podiatrists, speech and language therapists, physiotherapists, occupational therapists. There's a vast range of professions, radiographers, etc., that make up, other than nursing and midwifery, that make up the NHS. And they work collegiately out in the NHS. So there's absolutely every reason that we do that well within the
Yeah.
classroom to enable them to work better out in practice, because everybody will have an understanding of what everybody's role is.
And as part of a student on that course, it does give you a wealth of different knowledge to tap into, doesn't it?
Yes, it does. I think it makes you think differently because we all come from it from our professional silos, if you like. I'm a nurse, you're a nurse. We would view things similarly. But actually, when you're a therapist, you come at things from a slightly different angle. And having a different perspective on how maybe a patient would see it, on how they could support that patient better, that's what you need around the table to ensure that the patient gets the best care. It's not that you can do everything. We can't. We need to recognise when to
Yeah,
refer on and when to call on different expertise.
yeah, absolutely. My next one you've touched on very slightly, and I know you're very, very involved in this, and it's around the development of the regulation of advanced practice. And as you know, we were very lucky to be invited onto the early adopters programme as well. So really enjoy being part of that myself. Um, why do you think that regulation is so important to the patients and public?
It's patient safety. Ultimately, we're protecting the public, and that's what nursing and midwifery are all about, and healthcare in general. We need to ensure that there is that public safety. And currently, we don't know how many advanced practitioners there are out there. We can
Yeah,
guess that there are about 40,000, possibly 50,000 across the UK, but that doesn't give us a definitive number. And what we hear is that there are individuals who are practicing within scope, within advanced practice, but don't have the title. Or there are
yeah,
individuals who practice outside scope and have the title. It is a very challenging landscape at the moment because we just don't know. And therefore, because the NMC don't know, they don't have a register of who the advanced practitioners are.
yeah,
It's very difficult then to be able to say, as cases come in from fitness to practice, for example, actually, do we need this to support advanced practice through regulation? And the answer is yes, that's the NMC's decision to take forward advanced practice regulation to ensure patient safety.
yeah. And I think there is, although we've been around quite a long time now, there is still that mystique, isn't there, for patients and public? A
Yeah,
lot of them presume you're a doctor. I'm always say, well, you should always be introducing yourself as what you are, but there's a presumption among the public that they've been seen by a doctor, or they don't really know what that title means and what can you do if you've got that title.
absolutely right, Lisa. And I think, the NMC Advanced Practice Regulation Group has devised two different definitions, one for us as professionals and one that is layperson led, that is for the
Yeah,
public specifically, to give the public some understanding and appreciation of what advanced practice is. And I think there's a lot of education that needs to go on within healthcare around what advanced practice is and what it isn't, because I don't think sometimes it's clear there. So
yeah.
we then to educate us, to enable us then to educate patients better. But you're absolutely right. We should always introduce each other or one another, or when you're with a patient, that, I'm Anna Jones, I'm a nurse, I will be caring for you today. That's always really important. But we have examples of advanced practitioners who introduce themselves as, hello, I'm Anna, I'm an advanced practitioner, but I am a nurse and I will be caring for you today. And the patient turns around at the end and says, thank you, doctor. So
Yeah, yeah,
there's that education yet, I think we need to do yet. But advanced practice is firmly embedded in the workforce plan. And going forward, we need to ensure that it remains there and that people do begin to understand what it's all about.
without it remaining there at the centre, we're not going to achieve the plan and what we want to achieve, are we, for health for patients and
Mm,
public? It's
no,
absolutely critical to the delivery of that
yeah,
plan.
there's so much work out there for healthcare practitioners, regardless. There's room for all of us at this table. The workload, as we know, that areas understaffed, etc. Advanced practice practitioners assist and support that. We need people to understand the role, so that it's not a threat to individuals. It's an addition to the healthcare service that will support patients, which is ultimately the goal that we're all looking for.
So we were talking about our colleagues out there. I
Mm,
mean, I always tell a really funny story about my first day out there as an advanced practitioner, and it was in secondary care, it was in acute trust. And
yeah,
I was their first one. And I always remember the consultant walking on the ward round and tutting away and going, nurses prescribing, where will it end?
yeah,
So there
it
still is some of
absolutely.
that out there, isn't there?
There is, and I think there are a vast number of us who understand the role, but there are others who maybe haven't had the joy and the pleasure of working with an advanced practitioner. And actually, we are firmly embedded within the workforce plan, and we need to be helping and supporting one another as healthcare practitioners, rather than this bit of infighting, I think, that's going on at the minute.
Yeah,
Respecting roles and respecting professions and respecting that we are human beings and people, because I think
yeah,
that's being missed dramatically within the current political kind of
yeah.
minefield that exists around advanced practice and PAs particularly. That we're
Yeah,
people at the
because
end of the day.
we use that terminology, you know, it does take an army to care for a patient, and there is plenty of room for us all
Yes,
to
it
deliver on
absolutely
that.
does. Yeah. And the more people, you know, the wiser we are, the more perspectives that you'll invite around that table so that we get the right care and the right treatment delivered to the right patient.
Yeah, no, that's great. My last question is really about the new advanced practice principles.
Mm-hmm.
Do you think that these are enough to provide clarity on advanced practice to the public?
I think they're a very good start. I think,
Yeah,
you know, I'm very proud to have been part of that work. And particularly, I think the clarity that it's brought for employers. And in terms of early adoption of those principles,
yeah,
they're not the regulation, but they are a really good precursor to enable people to begin to understand what it's about and how it's going to impact them eventually in 2029, with the work starting next year in 2027 on getting the educational standards written and the proficiencies written. I think it's absolutely crucial that we produce them, and I do think that they're an exceptionally good start to the project and the process.
and I think, speaking from the early adopters group, it's really given us food for thought. You know, we have a vast number of ACPs, as you know, so it's really made us think about the governance around that, and where we need to start thinking and developing things to move forward, so that we can, when we're at the point this needs to be done, we're
Yeah,
ready.
yeah.
And that group is great for shared learning as well.
It is fantastic. I think people are so willing to share and willing to, you know, be very honest and frank about where they're up to and what they need support and help with. It does feel like an inclusive community, and it is a community of practice. And the sharing amongst the group is phenomenal. It's been a real eye opener that there's so many people who wanted to be part of the early
Yeah,
adopters group. That tells us everything, but also the fact that, you know, the principles, they're aligned to individuals and to employers, and that has given people an awful lot of, as you say, food for thought to enable them to begin to think about their practice and how they're going to develop that.
yeah. No, I've been part of it, has been invaluable for me,
Mm, mm,
in both my role as chief nurse, but as a advanced practitioner as well. I think
yeah.
it's been really, really valuable. Oh, Anna, it's been lovely to see you and
And
speak to
yourself,
you.
Lisa, always is, always is.
And as you know, give us a call if we can do anything to support you guys, because we're absolutely so proud of the work that you do.
And we're very, very proud to be working with Hallam Medical. Thank you so much, and say thank you to the team too.
I will do. And I'll see you soon.
Take care, Lisa. Bye bye.
Take care. Bye.